So exactly on time. Now, we know that there is, throughout Europe, a crisis in oncology nursing. Nursing vacancies are running, I think I'm right in saying, on average at around between 15 and 20%. And there's a real challenge around oncology nursing, recruitment, training, and retention. And I think the experience of many cancer centers that OECI works with is that one of the ways of addressing the challenges is to get a really good career structure for oncology nurses. And so it's a great pleasure to be, I can't see here, to be inviting Aino to come and talk from a Finnish perspective about oncology nursing in Finland. Aino.
Thank you. Hello everyone, so my name is Aino Kormilainen. I'm working as a clinical nurse specialist in Helsinki University Hospital. And as Simon said, we are lacking nurses all over the world, and I'm here to give you insight how we have empowered our cancer nurses and build their knowledge and professional growth with our cancer nurse education. So why do we need this special education? Like why one size doesn't fit for all if you're thinking about cancer nursing? So as we all know, globally the number of cancer patients is increasing rapidly, and so are the treatments and care for cancer also developing. So we need to keep up with that rapid changes and development. And that's why we need special training and education continuously. And of course, we want to ensure our patients get the best care possible, so that's why we need the new knowledge and competencies all the time and throughout the nursing career. When I think about the nursing education here in Finland, I know it's lacking the oncology studies. It doesn't really focus on oncology nursing or cancer nursing basically at all. So that's why we have to educate and train the nurses while they're already working with us. And then cancer nurses, oncology nursing is really specialized care, so that's why our nurses need deeper competence and understanding of the cancer nursing. So that's why we have developed this model called EMCAM model, so Empowering Cancer Nurses here in Finland. And this model describes the systematic way that we develop and support the nurses and their competence throughout their career. So as you can see here, the model consists of different modules, starting from the beginner until you are really proficient, when you are really professional on the cancer nursing. And this model consists of mandatory and also optional courses and trainings. And we evaluate the competence for each level with evaluative discussions, or then you might have some tasks to fill. And it's supported by evidence. So we know the education for what we are providing for our nurses is actually working, and they're actually competent, and they're on the level where they're supposed to be. And we offer this education on campus or partly online as well. So what was our goals with this EMCAM model when we came up with it? So we aim to strengthen the position of nursing and the nurses' autonomy and feeling of pride of being a nurse. I hate when somebody is saying, oh, I'm just a nurse, and I'm like, no, we are nurses, especially when you're a cancer nurse, you should be super proud. And then through the education that we provide for our nurses throughout their career, it increases job satisfaction and also the retention in our organizations. And then we maintain the professional skills throughout the career. So even though you have been working with our CCC center here in Helsinki for 10 years, you can always develop your skills and be more competent and get more education. And also we wanted to uniform the education and training for cancer nurses here in Finland. And within this model, the management can implement their strategy to provide the best care for the patients. So as you can see here, I have listed some of the education we have provided in the past and what we are still providing every year or every other year. So most of these education is targeted for the clinical nurses working with the patient care. But then we also have this senior leadership, which we are doing every year for our nurse managers and assistant nurse managers to support them in the leadership of cancer nurses. And this education has been organized and planned in collaboration with Metropolia University of Applied Sciences since 2013. And also one reason why we start this collaboration and educating our nurses more systematically was the OACI accreditation. So why we decided to include University of Applied Sciences in educating our nurses? So Metropolia offers us the pedagogical view and side of the education, like what works best, what teaching methods should we use for this and that model, or what works in this kind of cases, what kind of tasks, how do we test the nurses are competent enough in the level. And then in the other hand, we as HUS CCC, we are providing and giving the expertise and the experts, like our nurses, doctors, social therapists, so on. So because we are doing this kind of collaboration, we can be sure that the education is up to date and is giving the recent and most updated information about the cancer nursing. And all this education is planned and organized together with the nurses, all the nurse managers. So we always listen to the feedback of the nurses, like what do we need, what would we need in the next, let's say, senior leadership for the nurse managers? What are the current issues we are struggling with? And then, of course, we always have to think of the benefits. So for the cancer nurses, it, like I said, it increases the job satisfaction and engagement to the organization and cancer nursing. And it increases the autonomy, which is really a big part of being happy and satisfied about your job and what you do. And also being proud of what you do. Also a really big part of what we have noticed this education gives is the empowerment for the nurses. They feel they are more competent, they are empowered. And like I already mentioned, like proud of being nursing and my occupation and what I do on a daily basis. And then for the organizations, it's cost effective because we are providing the expert and the expertise and sometimes even the facilities where the education is taking, where it's organized. And then turnover rate decreases because the nurses, they really want to stick to the organization where they're being continuously educated. And then before I start, I'm really proud to say that we have finally finalized our magnet journey to nursing excellence. And we got our first magnet recognition on this year's March, just a few months ago. We have been working for this recognition for more than 10 years. And I think because we are OACI accredited, it helped us a lot already within this process. But magnet recognition is the highest recognition for nursing excellence. And it's given by American Nurses Credentialing Center. So I'm really happy to say that, and I'm very proud to say we are first magnet hospital in the Nordics and currently the second one in the whole Europe. So that's quite a big achievement. So I would like to thank you.
Well, first of all, Aino and your colleagues, congratulations on that Magnet award, which is really, really impressive. Yeah. We've got some time for questions, and I know there are some oncology nurses elsewhere in the audience. So let's have a little bit of a dialogue and some questions about not only your career structure. And there are, again, OACI, through the accreditation, notice big disparities of the degree of training and career structure for nurses and research nurses in Europe. There are some countries who don't have any specialist education actually in universities for oncology nursing, any master's degrees or whatever. So there are some gaps around there. Anyone like to come with a question, please, for Aino? Or to make a comment about oncology nursing? Yes, please, there at the back. Is a microphone coming? This lady who's waving at the...
Oh.
I'm so sorry. I missed your hand. I was pointing at this. You also like a question, yeah. Next one.
Hi. I was just wondering if somebody else wants to start this kind of project in their own center, what is the best way to start? What are the 3 main points that you think are the most important ones to consider in the first, because it looks really good. And in Estonia, we have been talking about a lot about this kind of topic, so it would be helpful.
Well, I would say like you need some structure. Like we had a lot of help from the Metropolia University of Applied Sciences, because even though we are a university hospital, we may not have the teaching. We don't have the teaching experience for the nurses so much, and like we are more into clinical teaching. But then we have to think. There's like so many things to talk to the nurses. So I would say the educational support from university is really top notch. And then you have to think. And I would say provide the education on different levels. Don't only stop when the nurses have been with you for, let's say, 5 years. Because what I have noticed, like many organizations, they first train the nurses when they are new. But after they have gained some experience, they stop it. And then those nurses with more experience, they also need to be educated. And they're actually looking for that. And involve your nurses when you start planning something like this. Because I think nurses, they have to be involved wherever nursing or nursing issues or stuff is talked about. So I would take those home notes. Yeah.
Thank you very much. Then there's a question down here.
Hi, Iona. I'm Jane. I'm from Ireland. Congratulations on achieving your magnet status as well. We're currently looking at that journey as well in our hospital. Did you find in the centre that magnet aligned with OECI, and what was your experience of having magnet and achieving OECI at the same time?
I would say like we benefit a lot that we have the OECI, because we have already some of the things that magnet actually requires us to have, like for example the education for all the levels. We had that already planned, and then I must say, like, because we are so familiar with the accreditation processes, I think the magnet site visit and process, the documentation went quite smoothly. So I think all the requirements from OECI definitely supported us for achieving magnets. So,
thank you.
Thanks.
And I can comment, I mean, we don't, in the OECI manual, there are not a huge number of specific standards actually on oncology nursing. It is included within the, as you say, the educational frameworks. But when we revise the standards, as I outlined this morning, every 5 years, we will be consulting EONs on their standards. We'll be comparing notes with that. The only thing we find when we consult professional organizations is they kind of always want more standards, of course, and if you consult, the radiation oncologists, they all want more standards. And so, but we have to keep the whole, as we're looking at comprehensiveness, we have to keep the whole number of standards within a manageable framework. But we're doing our best on the oncology nursing standards. Time for one final question, anyone? Or a comment? Is that Johan at the back? It is. Oh, lovely to see you. Microphone to him, please. Shout out for EONs.
Thank you very much. Thank you, Simon. So my name is Johan de Munter. I'm a cancer nurse manager in the University Hospital in Ghent, but I'm also past president of EONS. And I think we need to acknowledge that across Europe there is a big difference between cancer nursing, also in cancer nursing education, and the possibility to become a cancer nurse. But also EONS has, like also for, I think, the 8th edition on the cancer nursing education framework, that how we want to support European countries to provide that cancer nursing training and what needs to be included to become a cancer nurse. And therefore, Simon, we are very happy with EONS to collaborate on the accreditation and on the questions. And of course, we need to acknowledge that not the majority of questions is important, but the in-depth questions and the importance on what is the real necessity we need for that accreditation. And therefore, we are very happy to do this and to collaborate. But also, if you start the question on how to start this process, I think, first of all, it's also going back to your country and see there is a National Society of Cancer Nursing who can support. And next to me, there is past president of the Belgian Cancer Nursing Society, and I think they're also very great help into starting this process to maybe become a magnet hospital in this case, or to become part of the network and to strengthen your cancer nursing profession and education. And that, of course, EONS is also very happy to support and to be consulted in these matters. So a small comment, but congratulations in the achievements and keep up the good work. Thank you very much.
Thank you.
Thank you, Johan.
Thank you.
Thank you.
Thank you.
Well done.
Thanks.